Good afternoon, everyone. Thank you for joining our media availability today, especially kind of last minute. I have with me NCDHHS Medical Director of the Medical Consultation Unit in our Division of Public Health, Dr. Erica Wilson. She's here to help answer your questions. We just ask that everyone begin with just one question to start so we can ensure that everyone has the opportunity to ask their question. If there's time remaining toward the end, we will take follow-ups as time allows. If you have a question, you can either raise your hand to be called upon, or you're welcome to type your question in the chat box. This will also be recorded, and we are happy to share the recording after this is over with in case you need it. So we will go ahead and begin with questions. Whoever would like to raise their hand or put their question in the chat.
Hello, this is Shanila Kabir with CBS 17.
Yes, go ahead.
I see there were 71 deaths since I believe January 7th. Can you tell me how many out of those many deaths, how many of them were vaccinated?
We do not have complete vaccination data on all of those deaths yet, and may not, because vaccine for flu is not required to be reported for adults into our state immunization registry. And so that information is not currently available.
No problem. Thank you.
We'll take our next question.
Hey, can you hear me okay?
Yes,
Yes,
I can't
okay.
tell who this is, but yes, please
Yes.
introduce yourself.
Elena Athens from ABC 11. I think a lot of us know that there's been a lot kind of moving about in the air right now. And just kind of looking at the most recent press release that was sent out, 63 deaths for 1 week seems significant when you're putting into context how many there were for the totality of last year's flu season. So, is this of alarm for health officials? And is there an urgent kind of call for people to do something right now to stay protected during this time?
Yeah, so it is always so important during flu season for folks to get vaccinated. That is the best way to protect yourself and to protect your loved ones from flu. And then, if you're vaccinated, making sure that you're washing your hands well. Especially if you're particularly vulnerable to the flu, masking if you're in crowded places, covering your cough, and then very important to, if you do have any symptoms of the flu, stay home so that you don't spread that to anybody else. So continues to be very important for folks to take those protective measures against the flu.
Just to the first part of that question, I mean, is that a real significant jump? Have we seen that much, I guess, in 1 week before?
So the number of cases reported in a week, because of reporting the time that it takes to report a case, it doesn't mean that that is the date that they all died. So it's important when you're looking at those numbers and that jump to also look at the date of death for those, which you can see on our dashboard. It is by that week, and that gives you a better idea of what the true burden of flu is, because flu deaths often take a little bit to report. It takes a little bit of investigation to understand whether an individual died of the flu. And so looking at that number of what the new deaths reported in 1 week is not necessarily the best indicator.
Hi, Grace Haba here with WRAL. Looking at the data, obviously compared to last year, this year is off to a deadlier start. What do you think is driving this higher death count this early? Is it the severity of the virus, lower vaccination rates? Kind of speak to that a little bit.
So every flu season is different. And when the flu season peaks and when we see the most deaths does change a lot from year to year. So last year we had a much later flu season. It didn't really peak until February. This year we've seen one peak already in early January. So some of that difference is just the timing of the flu season. Last year we had a very deadly flu season. It was the worst since we started recording the highest number of deaths. It remains to be seen how bad this flu season is going to be. We have had one very high peak, but flu season still has a couple months left. And so we're going to have to see how long our season this year lasts. It's not uncommon for us to see 2 peaks in a season as different types of flu virus spread. So we are always concerned when we see deaths in a flu season, and especially see early deaths. We encourage everybody to get vaccinated. It is not too late, and to take the steps to protect themselves from flu. And that's the only way that we can mitigate the flu season and hopefully see fewer deaths this year than last year.
And I see Patrick Thomas has his hand raised, so we'll go to him next for a question.
Thank you. For the HHS team, I'm curious as to how you feel the rest of this flu season will go, given this already heavy amount of flu-related deaths we've seen. And I mean, I guess y'all tell me, seems like we still have a couple more months left of this flu season.
We do. We have a couple more months left of the flu season. And as I said, each flu season's different. And it's very hard to predict over that period of time exactly what the flu season is going to look like. We've had seasons that peaked early and didn't have a lot of activity in the later half of the season, but we've also had seasons that peaked early and then had a second peak that was even higher than the first. So, because of that, because we can't yet predict really what the flu season is going to look like from this point forward, it makes it particularly important for people to continue to protect themselves, continue to get vaccinated if they haven't already, to try to mitigate the spread of flu for the rest of the season.
And doctor, as a quick follow-up to that, the current statewide vaccination rate sits at around slightly above 21%. Given what we already know about the flu-related deaths and that low vaccination rate, how much is that a barometer for what could be an even worse flu season? Because there's a correlation here, and y'all keep going week to week to talk to us. So it does not to cast to be doom and gloom, but it seems like worse things are ahead.
Yeah, and certainly having low vaccination rates does increase the spread of flu. That's the best way to prevent hospitalization and death from the flu, is to be vaccinated. And so, yeah, we do worry when we see low vaccination rates. We do worry when we see a lot of deaths early on in the flu season. And that's why we come back to you and say, to just repeat that message. It's really important for folks to be vaccinated. It's really important to protect themselves from the flu, because that is the only way that we can prevent having a worse season for the rest of the season.
And we'll go to Kenny Beck next for a question.
Hi, Doctor. A lot of the things that you are saying here are things that health leaders at various levels have been saying for 5+ years, particularly with the start of COVID. Stay home if you're sick, wear a mask, wash your hands, and get the vaccine when it's available. How concerned are you that a lot of these best practices are falling on increasingly deaf ears, or at a bare minimum, increasingly unwilling ears?
It's certainly a concern for public health when we see decreasing vaccination rates. It's our best tool to prevent communicable disease. And when we see lowering vaccination rates, we see not only spread of flu, but recurrence of diseases that we have not seen in years, such as measles. Last year, the US had the most number of measles cases since 1991. And so that's certainly a concern in public health. We don't want to see anybody getting sick unnecessarily, anyone dying unnecessarily. And with vaccines being the best way to protect against that, when we see decreasing vaccination rates, that is certainly a big concern for us.
Do we have any other questions from our media partners in attendance? Oh, Patrick, looks like you have another one.
I'm so sorry, I forgot to take my hand down, but I guess in conclusion, I would wonder, what are the next steps on top of what you've done for outreach, communicating, messaging, marketing, what have you, with your local and county health departments, might you consider if these trends continue at this rate?
So I think when we are messaging vaccines, it's important for people to hear these messages from the people they trust. And whether that's a community leader, whether it's a health department, whether it's their primary care doctor, for all of those folks to be communicating the importance of vaccines, that these are the safest, most effective ways of preventing the spread of communicable disease for those diseases for which we have a vaccine, is really important for that message to be coming from all of those trusted partners in the community, especially the folks that we're here at the state. Somebody may not know us personally, but they know their primary care doctor. They know their community leaders, and to have that messaging coming from all those trusted community members is also very important.
We have time for several more questions. If anybody has any, you're welcome to raise your hand or paste them in the chat.
I'm Adam Wagner from WNC. I'm wondering if, Dr. Wilson, you have any thoughts as to the research that indicated that the flu vaccine this year might not be that great a match for the flu that's circulating, and if that's playing any role in what we're seeing here.
So we're still waiting for the full vaccine effectiveness studies in the US. However, some of the preliminary data has indicated that while the initial, this year's flu virus called H3N2 subclade K is different from the vaccine still provides protection against hospitalization and death. And so we're still encouraging people to get vaccinated. I also say that we often see peaks in a flu season with different types of flu. So our first peak that we've had, it was that new subclade K, but it's also possible that we could get a second peak that is another flu virus that may be a match to the vaccine as well. And so it's still important for folks to get vaccinated because there's more than one flu virus in that vaccine. And even if one isn't as good a match as it could be, first, that still provides some protection. And you also have those other viruses that may be better matches and provide protection against those other circulating flu strains.
We welcome any other questions that anybody might have. Oh, we have one in the chat. I'll read this. Is the data on the detailed respiratory virus surveillance dashboard available broken down by county or region? And are there any communities seeing disproportionately high deaths from the flu?
So it is broken down, available by region. It's on that same dashboard. If you go to the landing page, that is there, and there is a regional view to see all of that ILI and CLI, so influenza-like illness and COVID-like illness data broken down by regions. And there's a map to show what regions are color-coded to which color. And so that will show trends. You do have to be cautious when interpreting that particular type of data because different hospital systems have slightly different ways that they code flu data. Getting technical, but it comes from electronic coding, and so you do have to be careful to look at trends and not absolute differences between regions.
And Erica, I'll just make sure it was a lot in one question. So her second question was, are there any communities seeing disproportionately high deaths from the flu?
I myself have not looked at the deaths broken down by county. I will have to ask our respiratory team and I can follow up with that data.
Any other questions from anyone in attendance?
Just sort of following up on that last question, are there any other trends among the deaths in terms of age? I don't know. Anything else? Any other things among the people that have died now?
Yeah, so folks who are older, over 65, are generally more vulnerable to the flu, and we do see the majority of our deaths in that age group. So a significant proportion, the majority of our deaths, 104, have been in those over 65 years old.
And we got a thank you in the chat. We've got just a few more minutes. Just want to make sure that everybody has their questions answered. Everybody has a chance. So if there's any last questions, feel free to raise your hand or put them in the chat. Hearing and seeing none, I believe that that will conclude our media availability. So thank you all for joining. If you do have any follow-up questions that have not been answered today, or you think of them afterwards, you are welcome to email our news team. I will put their email in the chat so you can reach them directly. And we thank you all for being great partners and covering this important information. Thank you.
Recording stopped.